This episode of Friends of Flow is brought to you by NCLEX Mastery. If you're a nursing student and you're about to take your NCLEX, you need to go to the App Store right now and download NCLEX Mastery.
Hey everyone, welcome back to Friends of Flow. This is Dr. Andrew Whitters here.
And I'm Dr. Rebecca Porter.
And
Welcome back.
Yeah, and today we're missing one of our colleagues.
I know Tessie had another obligation today.
Yeah.
So we miss her, and a shout out to Tess.
Yes, a shout out to Tess. Right, there you go.
Great.
Yeah. Hey Tess. So it's just us today, Dr. Porter and myself. So here we go.
So we've had some comments about people talking about being bullied or incivility at work and what to do.
Yeah.
So have you experienced had people being rude to you or felt that you were bullied?
Yeah. Oh yeah.
Tell me a story.
I think in my experience, even observationally now as an advanced practice nurse, I mean, I think it's still pervasive in the nursing culture. I think that the idea that nurses eat their young, I think, is very real. Mm-hmm. I've personally experienced it. Just I remember as a new nurse, this is the better part of 10 years ago now, being in an ICU setting. I of course won't say where, but just getting my questions answered. It was seen as a pervasive degree of annoyance. I was treated like a lesser form of a nurse. When I had questions about our system, or if I had questions about a particular clinical issue with a patient that I might not have had exposure to, it was just really, and it added to my frustration and daily stress grind. So I do think it's common. I think it continues to happen today. I don't think that nurses are very good about supporting each other. I think that we as a culture, as a nursing culture, is far more inclined to break each other down than we are to build each other up. And so I think there are stories out there all over the place.
When I was looking at the literature on incivility or bullying, almost 100% of people in the workforce, 99% of people, say that they've been a target of bullying, and less than 1% of people admit to having been the bullier. Isn't that interesting?
Yeah, right.
And in nursing, most of the bullying seems to come from upper management, from nurse managers to staff. But I would like to just take a step back, 2 steps back. And one is to talk about the continuum of what is bullying. And then we need to move into what does it cost? And then let's go into how do I respond?
Yeah, solutions.
Because I don't think we're taught in nursing school conflict resolution,
right?
And what to do when we encounter conflict. So incivility. When do you feel disrespected, Andrew?
I think when I'm either questioned, especially now as a prescriptive care provider, if I'm being questioned in a way that is just not professional.
Like what? Give me an example.
I think there's a way to question a prescriptive care provider when
by another nurse.
By anyone. I mean, I think that we have an obligation to be open, to hear constructive feedback. But if I write an order and I hear someone mumble under their breath, well, that's just dumb. I immediately put it to bed and say, well, hey, why do you disagree? Like, tell me why you think it's dumb. And then I have to bear witness to someone, maybe getting embarrassed that they didn't think that I heard it or something. But because it just needs to be at my level, I just want to just kill it.
So it's these sort of under the breath comments.
Yeah, under the breath comments.
You feel disrespected. So yeah. I feel disrespected when somebody rolls their eyes. When I've said something and
nonverbals,
the nonverbal stuff really grates on me.
Or even like the sighs.
A sigh, or when I'm teaching, and people in the front row were actually looking on their cell phones at bridal dresses right in front of me.
Just not engaged.
Just like I thought, am I really that boring? Like I thought this was pretty exciting stuff that I was talking about. So it's this nonverbal stuff that we can call bullying. It can be gossip. People sitting in the conference room, chit-chatting, or at the nursing station.
Yeah.
Not saying nice things about somebody. So that's another kind of bullying. And then you see the person that they're talking about, or that you are talking, or that I've been talking about, walk by. Or my favorite is when I've said something not very nice in an email within my family about another family member. You know how that goes.
Yeah.
And then I thought, oh, did I include them on that email? And you just break out into this sweat because I've been not nice. And it reminds me of what it feels like to not be nice.
Yeah.
So there's that kind of bullying. And then there's the kind where you get yelled at. Why? What are you doing? Who do you think you are to do that? That kind of bullying. Or that you feel disrespected by that, or challenged.
I do think that nurses get yelled at. I mean, I think that's another. I think that we get yelled at by other providers, whether they be other nurses or physicians or.
But there are times when a voice does need to be raised. If you are going to inject medication into an arterial line, and you're the preceptor, and you watch somebody decide to inject something into the arterial line, are you going to go, hey, oh, don't do that. Oh, no. Or are you going to just sort of go, oh my gosh, stop that.
Yeah.
And that poor student might take that as being yelled at, when in fact it was necessary to stop something bad from happening.
But after a situation like that, I think there should be a debriefing. And I think that there generally is. I mean, because it's a learning opportunity, and I think that's what most yelling situations can be turned into with the right kind of positive attitude. I think it's the yelling episodes that challenges a person's intelligence, or even decision making skills that might not even be critical in nature, but if they ask a question, maybe, and if they get yelled at, that's just inappropriate. And right. Those are the kind of things that now in my career, I've learned to feel very comfortable just calling out a bully for what they're worth. Not necessarily calling them a bully, but just saying, hey, like why are you yelling?
Well, see, I think that one of the ways to address that kind of behavior is that, yeah, you want to put them on the spot. Why are you doing that? But if you challenge them in that way, it's going to escalate the situation. But what you want to do, I think what you want to do is when you yell, I feel scared, and the patient isn't going to get what they need.
Right, yeah.
So when you do this is what happens.
Yeah.
When you mutter under your breath about, I heard some under the breath comments while I was writing that prescription or after I wrote that order. When I hear that, it makes me feel disrespected, and it makes me wonder whether we should have a conversation about whether this is appropriate for the patient. So it gets it off of you and me. And gets it back where it belongs, on the patient.
Right.
So
I think when you can circle around and make the patient the focus of a conversation, emotions tend to just simmer down. Right. And what, no matter who it came from, if you can just say call out the behavior and then just say, hey, can we come to a common consensus about what we're doing for this
this
this patient?
Right.
And
So one of the comments on that somebody wrote in was that their nurse manager was sitting in her office or sitting at the desk and not helping with some patient care. And the comment from the nurse manager to this new nurse was, well, you just need to get out there and learn. And how would you respond to that?
Yeah.
What would you, what do you think you would
the
do?
younger me would have probably, crawled under the desk and metaphorically speaking, of course, but I probably would have shied away from any further confrontation.
Yeah, the younger me, I was bullied terribly in my very first job, and this is long, many, many, many years ago, and in a different country, I was yelled at constantly by my nurse manager and berated and derided constantly in front of everybody, and I stood up to her. Mm-hmm. I just said, I will not be spoken to like that. And I ended up leaving. It was a messy situation. But
how'd that work for you, though, short term? I mean, how was the response?
Oh, I am not. Oh, no. I am fine. I went and talked. It was at a small hospital, and I went to the chief of medicine and said she had written my 3-month evaluation, and it was terrible. And I know that I was not the person she was writing about. I knew I was a much better nurse and a much better person than what she was saying. And so I went to the chief of medicine, and I wrote an 11-page rebuttal and refused to sign my evaluation form. And I stood up for myself. I refused.
And what a cerebral response. I mean, that's for a new and young
brand new nurse. But
for me now, my new, younger, novice nursing personality probably would not have done anything. I probably would have sunk back into my own shell, found another way to internally cope with it and move on. But I think now I would say to this nurse manager in this kind of a situation that this viewer wrote in, I would just simply say to the nurse manager, I need your leadership advice and paint
the
it.
Patient needs your insight and expertise right now, and I learn best.
But I think turning it back on the nurse manager by saying your leadership is important. I'm in need of it. I need your help. Is an opportunity for like the ball's in their court then to respond in a way that can then maybe make it more of a patient-centered issue. So even the person who might feel like they're being bullied in this situation or being ignored, perhaps is a better word, they can humble themselves even further by taking a high road and then putting it right back in their court, saying, I need your leadership. Like, what do you suggest? Like, Tom, give me your advice. What was your experience? What would you do in this situation? I mean, like, comments like that tend to de-escalate. It tends to validate the opinion of the person who might not be fully engaged, in this case, the manager. And hopefully the response should be, especially in a person who's in a leadership position, to come back and say, yeah, gotcha. Okay, so you need some guidance here. Let me provide that for you. And that's right. Mrs. So-and-so, patient XYZ over here does need maybe some additional attention, but I can see where you're coming from. And so it's a way of just rethinking, re-engaging, finding just, and some of this is just personality flaws that we all have as nurses, and trying to go around those
that conflict avoidance. And I'm just not going to, I got a response from my nurse manager that didn't make me feel good, so I'm just going to go crawl in a hole and feel really insecure or quit. But I read a really interesting article yesterday in the Wall Street Journal about, it's called Managing Up. And what we need to learn to do, no matter what your position is figure out how to communicate with your manager. no matter what position you're in. So study your nurse manager. When you interview for that first job or you're interviewing for a job,
that's great advice.
Is to really study the nurse manager. What does the unit look like? What does the manager's office look like? Is it chaotic and a disaster? Can you work in a chaotic environment where the nurse manager looks like papers are all over the place and scattered? Or do you want to walk into an office and interview with somebody where the unit is tidy? Like, you have to know what you want.
Sure.
So when you're working and you manage up, so in an interview, when you're learning your nurse manager, is to watch how he or she communicates with everybody.
The interactions are important.
Study them at work. How are they interacting? What are they doing? Is this a good fit for you? And think about what you would do in that position. And my best advice is to keep the patient first.
Yeah,
and not
absolutely.
make it about how you feel or how the nurse manager or a coworker. I remember that when I was giving a talk on incivility to radiology technology people, somebody said, well, this person keeps coming in and saying, will you help me? And this manager said, well, I always say, how come you haven't asked for help from person X? Why aren't you doing this? And so how do I handle that? This manager said. And I said, I thought about it for a minute, and I thought, maybe they're being bullied.
Yeah.
Maybe they're feeling insecure by their coworkers.
Yeah.
And so a better response for the nurse manager, instead of saying, have you asked Tom or Karen for help, is to say to that person who wants your help, is to say, have you asked? And in a quiet place, say, can you tell me about your interactions, about why you haven't asked? Or what have your previous experiences been? And just to feel that kind of nurturing mentoring.
Yeah.
But also, when you think your nurse manager is just sitting on their butt, to stop for a minute and think about what are the myriad of responsibilities your nurse manager has.
True, yeah.
And to have it just one day go in and say, tell me about your job.
Yeah.
Tell me what it's like to do how do you be a nurse manager? How do you do this? What are you looking at? How do you know what's important?
Understanding processes.
Yeah.
And I do think that's the responsibility of nurses. I mean, as they grow into their specialty and just general profession, understand what the engagement looks like for
everybody,
for everyone. Yeah, for especially for your leadership, because I think sometimes we again, culturally, nurses will perhaps badmouth their leadership in the break rooms and in conversation around a nurse's station, but they're human too, and they're tasked with some pretty heavy duties that aren't often patient focused.
It's invisible work.
Yeah, it is. Not to mention budgetary issues that oftentimes aren't shared because they can't be.
They can't be, and you don't want to stress the staff.
Yeah, exactly. And so in my experience, I mean, a good nurse leader will always make sure that his or her staff is engaged at the patient level, and the rest of the duties that are above that, whether it be the financial duties or the capital management issues, it becomes a non-issue for a floor nurse, especially.
But it's still important to manage up.
Oh yeah,
for you
up,
as
sure.
a staff nurse or a new nurse practitioner in a workplace, manage up. Know what the management is doing.
Yeah.
Figure out what their issues are, and get a global feeling of what's going on. Here, somebody else wrote in and said that they are being laughed at. That's a really That's really hard to know that you're being laughed at. And how would you, I'd like to unpack it with that person and
I would like
find
to
out.
unpack that too. I want to know sort of the context, I guess. I mean, being laughed at, it just sounds on the surface just humiliating.
No kidding. Like maybe he asked a seemingly innocent question.
Right.
And some senior person just sort of went, oh, ha, 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 you don't even know that.
Yeah. I mean, that's a difficult one to unpack. Especially without knowing, like, I guess the context.
I guess my advice would be, or my insight would be to this person who asked that question or made that statement, and others who have been laughed at, I think we've all been laughed at for something, is to sit back and think about, what did I just say? How did I say it? And how will I respond next time? Because it is really humiliating to be laughed at.
Yeah.
And if it happens again, maybe take that person aside and say, when you were laughing at me, I wanted to know what it was, and was it something related to patient care? Because if it is, can you share with me?
Yeah. That takes a lot of courage, though, too, to like take someone aside and be like, hey.
Yeah, but we're adults.
Yeah, sure.
I mean,
sure.
you're not a 15-year-old nurse. You're probably a 22 or 23-year-old adult who votes, who can carry a gun, who can drive a car, who can get married, have kids. So put on your big boy panties and your big girl panties and stand up straight and have an adult conversation.
Yeah.
And stop being a little wimpy.
Yeah. Yeah. So I guess in a way, get some thick skin though too, is what you're saying.
Yeah. Like not everybody gets a trophy all the time.
Yeah, and that goes into like the generational issues though too that we have discussed on previous podcasts of Friends of Flow, and so being laughed at.
That's a tough one.
Yeah, I like to kill those issues just with the
humor.
Yeah, and if it is something that I guess I would look at myself first and be like, gosh, am I being a goofball like right now? And maybe I can turn that into
something funny.
Yeah, maybe I can turn it into something that's funny. And
so somebody else said that they had been told in response to asking advice to look it up, whatever that means. So again, that comes back to if it's a really life-threatening or this has to be answered immediately kind of question for patient safety.
Yeah.
What's the best way to ask for information? If it's a critical situation, of course, ask a senior person that you trust, a mentor. But if it's not so urgent, if it can wait, 5 minutes or 10 minutes.
It's the art of how the question and when the question is perhaps asked.
So do you look up stuff yourself before you ask a question of somebody?
Sometimes. And sometimes I remember when I was a brand new nurse in the ICU, I would try to know what my care assignment might be the next day. I would do my homework on the patient, be as buttoned up as I could to understand the diagnoses, maybe what labs, what drugs I'm going to be passing, those types of things. And that was just the professional expectation on my floor. I liked it because it was challenging, but I could come in the next day and I felt I was relatively prepared.
I did the same thing, Andrew, but I was a critical care nurse before computers.
Yeah.
I'm that old.
Yeah.
And I did the same thing. I would come in, I would know my assignment for the next day.
Yeah. And
I would come in with books. I would have 3 or 4 textbooks with me, physiology, pharmacology, a critical care nursing textbook, and I would have them all at the bedside. And I would just be reading voraciously for what my patient's situation was, in addition to understanding who my patient is as a person.
Yeah.
And so when you're told to look it up,
Yeah.
and when you want to know something, do a quick literature search.
Yeah.
And in the real literature, not just a Google question.
Sure, when time permits, for sure.
But if it is a critical question, say to the person, I would otherwise look this up, but this patient's blood pressure is tanking. Should I put up the medication? Like, do I titrate this now, or how do I do this? Yeah. Hey, let's take a break for a few minutes.
Perfect. Let's do this.
Here at NCLEX Mastery, we love nurses and especially nursing students, but we need your feedback about this podcast. If you have ideas on topics or you have questions you want us to answer, shoot us a message, leave a comment, go to our Facebook page, and just tell us what you think, because we want to help you in the most specific way that you need that help. Thank you so much.
Hello and welcome back to Friends of Flow. This is Dr. Andrew Whitters, and we got Rebecca Porter over here.
Yeah. We were just talking about incivility or bullying, and
Right.
On our break, we were talking a little bit about nonverbal,
Right.
the eye-to-eye contact, and what happens in the cath lab, what happens in the OR or another procedural, and how much nonverbal communication there is. And Andrew, you started to talk about that a little bit. Can you remember your story?
We had a viewer comment that what do you do in the operating room environment when you have eye rolling in the OR environment, as many of our listeners might relate to. The OR environment is you're in this sterile environment with gowns and gloves on. You might have a hood on, certainly a mask. So your physical features, facial features, everything's covered. So you just have your eyes to deal with and to sometimes communicate other than your voice. And the listener commented, "What do you do when someone is eye rolling in the operating room environment?" And the OR is a unique place for a lot of the reasons I just mentioned. It doesn't get any more patient focused than in the OR, in my opinion. You have someone who's anesthetized. They are truly, in the greater sense, helpless. They're depending on others to literally intervene to save their lives. So I think it requires a great deal of focus, and to a degree, you need to let things roll off your back in the OR. And then once the case is over, if you have a colleague who you want to debrief with, as I like to say, then approach it that way. During the case is
not the time.
Just not the time. Like and this is an opportunity for nurses to grow some thick skin and refocus your energy, and you can show it too by your actions in the operating room, by making sure that your instrumentation is certainly ready, asking questions to the anesthesiologist or the operating
the surgeon,
provider.
whoever.
Hey, are we doing okay up here? The vital signs looking good. Just talk it out. Be vocal about being patient focused. Refocus the group. Circulators within the operating room environment do the same thing. So I would say rise above with your actions, and in this case, certainly show that you're patient focused. And then after the case, I
like your idea of a debriefing.
Yeah,
and to be able to ask that person, could we have a chat just for a few seconds, and make it in a private place in a corner of the locker room, and just say, I noticed that your eyes communicated, or I felt that you were angry, you were frustrated, you were mocking me, or something was wrong, and that I just didn't respond at that time. Can you tell me more about what you were thinking at that time?
Yeah, and in the OR situations, it might truly be nothing, because like that's all you have to express yourself are your words, and sometimes like you can't use your words because we need to concentrate. but then your eyes do a lot of that nonverbal communication. And so sometimes it just needs some simple clarification. But I think those are the opportunities for growth and growing some thick skin, if you will.
It's also a time for team building.
Sure.
And I was talking to an OR nurse where I work, and I asked her what drew her to working in the OR, because I couldn't imagine working in the OR. And she talked about how great the team is, that she loves the team that she works with, and that they know one another, and the respect among everybody on their team, and how they get to know each other. And she talked about people can just look at you and you know what they need or what they want. And those few fleeting minutes with the patient awake, and it gets everybody focused on the patient.
Yeah.
And then the patient is anesthetized, and you go to work.
Yeah.
And you're there as a team with one purpose.
Yeah, it's game time.
It's game time. And she just sparkled when she talked about it. So one of the things to think about is, in addition to, I like your comment about building thick skin, is self-awareness.
Mm-hmm.
Are you in the right place for you?
Right.
And I had a comment from a nurse a couple of weeks ago. We were talking about the resolution of some conflict, staff conflict. And this nurse said to me, I love my job. I want to be here every day that I'm on. I come in here because I want to be here. I sometimes feel that some other nurses are here because they, air quotes, need to be. I mean, we all need a paycheck, but the need to be, in air quotes, is that's where we get our professional integrity. I am nobody if I'm not an ICU nurse. I am a nobody unless I'm a med-surg nurse. I am a nobody unless I'm a nurse practitioner, when that's not the truth at all.
Mm-hmm.
The truth is you are who you are no matter where you work. And so, are you where you want to be, or do you have this crazy need to be where you are?
Yeah.
Because then you're not going to be your best self.
Well, that's very interesting. Yeah, those are some philosophical thoughts too, perhaps.
You know
I think.
me.
Yeah. That's all good.
So this sort of segues into one of my other favorite topics, which is developing resilience.
Yes.
Because what nurses do, what everybody in healthcare, the nursing aides, the nursing assistants, our physician colleagues, everybody is working so hard. And you and I were talking earlier, Andrew, about the impact of technology and losing focus on the patient.
Yeah.
And the person, because there are so many distractions. And so in addition to
so many.
In addition to the technology distractions away from the patient, it's just what we were talking about bullying, because that takes our eye off of the patient.
Exactly.
So, you talk about developing a thick skin, and I think that's a great analogy to building or developing resilience. The verb resilience, to be resilient, and to develop adjective resiliency. Yeah.
I do think if we could just take a step back from into the bullying issue, just one last time, I think it's important for when a person feels disrespected, or if they are being bullied or not communicated in a way that, or not being communicated with in a way they feel built up, is to talk to your fellow colleague without necessarily going to the nurse manager first.
Oh, right. Good point.
Because I think that's we talk about respect. If you even feel disrespected, it's important to turn around and show that person respect anyway. I mean, it's that whole golden rule thing, right? And you can get yourself to have thicker skin by exercising the behaviors that you want to be treated with as well. And so, and we did speak about that on the break as well, that just going to your nurse manager as a sort of that
reaction.
Yeah, that gut reaction or that prepubescent, sort of action of, well, I'm just going to go tell, I mean, that doesn't work in the nursing world all the time. I think that if you can approach it head on with a fellow colleague
in a way that you would like to be approached.
Yeah,
and
exactly.
not the mean girl or the mean boy.
Yeah.
Like that's high school mean girl, junior high stuff. But this is being an adult and talking to that person how you would want to be talked to. If I had been, and I have been rude to people. I mean, we're all human, and we have our boiling points, and when I've been mean to somebody, I feel terrible, and what I want to do is apologize, sincerely. And so when somebody comes to me and says, "Wow, I was really hurt when you did that," or "I just didn't feel confident in my care of that patient after you said that," really hits me in the gut. It would.
Yeah.
So I think it's to approach that person how you would like to be approached.
Yeah.
And to think about that. It's like Michelle Obama said, when they go low, we go high.
Yeah. And that makes you a tougher person, Yeah.
So it's debriefing with one another. And I think a lot can be gained from sharing perspectives. And what did you think? I thought this was a really stressful code that we just had. And why I felt that, like, why did you yell at me at that point? Like, you were so directive, and I've never seen you like that before. Well, wow, that I felt really intimidated because you were really stern and telling people what to do. And I just got really scared in that code. And my friend would say, it was a code.
Yeah.
This person's life was on the line. We don't say please. We don't say thank you. I am focused on getting this person back to life.
Yeah.
If we can. And friendships aside, this is what you do in a code. So wasn't it great? We got them back. And now we both know what to do.
Yeah, and how to roll forward now.
How to roll forward. And that's that resilience part of rolling forward.
Yeah.
One of my favorite slides I have is a jack-in-the-box. Did you have a jack-in-the-box when you were growing up?
I
round
did.
and round the mulberry bush, and then up pops the weasel. You know, that little jack-in-the-box clown thing? That's not resilience.
Yeah, that's
not resilience.
Yeah, I would agree. Yeah.
So did you take physics?
I did. I took physics.
Yeah, me too. I almost failed. In fact, my teacher in high school, I did have physics to get into nursing, and grade 12 physics. About did me in, and I was getting coached by the football coach, who was a physics teacher, and he made me promise never ever to take physics again if he passed me.
Yeah.
I obliged. Did you do physics in university?
I did.
I am impressed.
And I think that that taking those upper level science classes, it translates well, in my opinion, to the nursing profession. I do actually wish that there were more science classes in nursing programs.
Oh, I wish there were more liberal arts so that we could learn critical thinking.
Oh, sure,
and philosophy and understanding.
Well, I think a combination of all those things helps critical thinking.
But let's go back to physics.
Yeah.
Because I was talking about resilience.
Yes, resilience.
And so when you think about the definition of resilience from physics properties, which is where I was going with this, Andrew.
Gotcha.
Is that in physics, things rebound to their former shape. But in human capacity, resilience is our ability to be transformed. Mm-hmm. And we all feel stress differently. What you find stressful might not even ruffle my feathers.
Right, exactly.
What rocks my boat and tips over my boat might not even be close to anything that you feel. So everybody is different, and we all respond differently. But when our capacity is exceeded, chronically, we begin to move into that burnout phase.
Yeah.
And you might see people at work. And again, that's looking at, do you want to be here? Does that person want to be there? Or do they need to be there for their own kind of personal credibility? But when we look at being burned out, why do nurses burn out? There's a whole bunch of reasons. We're taught in nursing school that we can do it all.
Mm-hmm.
We're taught in nursing school not to do conflict management. We're never taught conflict management. In nursing school, we're taught to be perfectionists. We're taught to be the Lone Ranger. You go out there and you do it, which is why that nurse manager might respond, you need to learn, or get out there and do it, or go look it up.
Mm-hmm.
So that's the old school of nursing.
Yeah, it is old school. I was just gonna say that. I think that's...
so nurses burn out because of our job. It can be pretty overwhelming.
Yeah.
And when patients die,
it's rough.
It's hard, and sometimes we're taught to maintain that cool exterior and not to cry.
Mm-hmm.
We're taught not to get close to patients, and that's not normal. That's not being a normal human being. We respect professional boundaries, but you can show concern and care with a hand on somebody's arm.
Absolutely.
You can show care and concern by having tears in your eyes because this is a human being who's suffering.
Mm-hmm.
And you are witnessing suffering quite often.
Mm-hmm.
Nurses have a huge amount of responsibility. You just got a call while we were talking here from about a patient in the hospital with a weird blood infection. That's really stressful. I mean, it's a distraction.
Yeah.
It's a huge responsibility. And sometimes in nursing, we have these huge responsibilities, but we don't have the autonomy to make those decisions, or that they have to go through somebody else. And it's this invisible work that we carry with us. Nurses burn out because of shift work.
Yeah.
Nurses burn out because we're tired.
Yeah.
So, and we're not really taught how to blend work and personal life.
Yeah.
They talk about balancing it, but I don't think you can balance it. I think it's a blending. In our earlier segment today, Andrew, we talked about how we prepare for work for the next day.
Mm-hmm.
And that's a blending.
Oh, it certainly is.
And so we blend our work because it is who we are. We are nurses, but we also are people with outside interests. So that goes into the resilience part about making sure that we take time to decompress.
Sure.
That we get the sleep that our bodies need,
mm-hmm.
that we get the exercise that our bodies need and deserve, that we're eating well, especially at work, that you take no junk food to work, but you take food that nourishes your body, because you need this body for the next 50, 60 years.
Yeah, I'm hoping to make it that far, yeah.
Yeah, you better.
Yeah.
And I plan on it.
Yeah.
Well, that would make me about 180, but, you know.
Yeah, you never know
You
with the
never
future.
know.
Yeah.
So the other ways to build resiliency are positive relationships.
Oh, for sure.
You know, and at work, when the chemistry is right between people, it's not work. It's how you spend your time. It's just you know you're in your sweet spot when you're working with your friends.
Yeah.
You know? And so the positive relationships at work are really important. And there's really important social relationships in your life outside of work, and indeed it might be work friends. Some of my best friends are people from work from 30 years ago. Other ways of looking after yourself, my very favorite is gratitude.
Yeah.
There's some great research from positive psychology that at UPenn from about 15, 18 years ago that showed that by writing down every day 3 things that you're grateful for actually changes the chemistry in your head.
Changes your behavior too, I would imagine.
Yeah. So that when you're in these really stressful situations, you automatically start thinking of the things that you're grateful for, so that you're not focusing on the person who's bullying you. You're not focusing on feeling overwhelmed at work. You're not feeling horrible at work, but you're saying, I'm so grateful for Tara at work because she answered my question with such grace. I'm grateful for Brian at work because he made me laugh in the middle of a really hard day. I'm grateful for my kids because they bring me this unconditional love.
Yeah. Yeah.
You know, and you just stop and you think. My husband and I have dinner together almost every night. And we always start with a conversation about how did your day go? And then I will say, so what are you grateful for today? And he'll say, well, what are you grateful for today? And it always includes one another.
Yeah.
And so
really
if you've got, and one of the doctors I work with, after he's had a really tough conversation with a patient or a very difficult situation, he goes out into the hallway or into the conference room, and he said he pulls out his cell phone, and he said, people can think whatever they want to think, but what I'm doing is I'm pulling up my gratitude list. And every time I think of something I'm so grateful for, or a person I'm grateful for, I have it on my cell phone in my list of things that I'm grateful for. And he said it helps me instantly reconnect with who I am and what I'm about and why I am here doing the work that I do. So being grateful is just the key to helping to change head chemistry. And having the compassion for yourself that you have for your patients and compassion for one another. And you know what's really cool is that the new 2014-15 Nursing Code of Ethics actually has a whole section on self-compassion and self-care and self-respect. So it is important that we carry that with us in this tumultuous time in where we work and the environments that we all work in. It's just so very important to go back to that basic human caring.
Yeah, absolutely.
That end.
That's probably a good place to end right now. So thank you, Rebecca.
Oh, you're welcome. It's been really fun talking to you, Andrew. And we have a guest here today, one of Andrew's students, who's been writing us little questions and notes and making comments. And we're grateful for her being here today.
Yes. Thank you, Harmony Tambura.
Thank you, Harmony.
And so this is Andrew Whitters here telling you to innovate, agitate, and educate.
And this is Rebecca saying farewell for today and take time to be grateful.
All right. Friends
Adios.
of Flow, out.
Here at NCLEX Mastery, we love nurses and especially nursing students, but we need your feedback about this podcast. If you have ideas on topics or you have questions you want us to answer, shoot us a message, leave a comment, go to our Facebook page, and just tell us what you think because we want to help you in the most specific way that you need that help. Thank you so much.